see right now, the processes in many health organizations are really outdated, and they're lagging behind of the industry in engineering section or IT. We cannot stay in one place for long. We must change, we must evolve, and be brave to trust the technology.
I'm a clinical psychologist, and I have always wanted to design better treatment for people working for anxiety disorders. And one of the problems is you have to help patients face their fear, what we call exposure. Exposure is practical because it works, it's the key ingredient, but it's also complicated. For example, fear of flying, it means that patients have to take the airplane. And fear of height, it means that we have to go to high places.
People are very reluctant to seek help, especially with mental disorders. And that's why gamification was such a big deal. Gamified processes makes us more willing to participate. And that's the most important thing in any therapy.
Ourselves in a mental health crisis. Our healthcare providers are burnt out. Our system is overloaded. Getting treatment can be expensive, not to mention inaccessible to many. And the stigma around mental health can prevent many from getting help. So we need more realistic experiences to practice emotion regulation skills development. And that's where VR comes in. Because we can simulate these experiences that elicit strong emotional reactions so people can practice their emotion response system. So one of the studies that we did in our lab, the iSpace lab, was eliciting the strong emotion of awe and wonder. This was an experience designed as a countermeasure to sensory deprivation for astronauts. And the idea was that if they're going to Mars, it's going to be a really long time where they're not seeing anyone, they're not able to travel, they're in a very confined space for a long time. And with that comes kind of depression and anxiety. And I'm sure we can all relate to that. With the COVID-19 restrictions placed on us, having some sort of countermeasure to that social isolation is crucial. When you take off the headset, our participants told us they felt a deep sense of appreciation and connection to our planet. So what this shows is that we can create virtual reality experiences that elicit strong emotions. And those experiences in virtual reality, they stay with us. They can transfer outside of virtual reality. So with emotion regulation skills development, there's huge potential there.